We want to welcome you to Pinnacle Health and Benefits, to our team's first educational event of 2022, which is Maneuvering Milestones, HSAs, and Medicare Eligibility. Now, we get a ton of questions on how HSAs and Medicare interact with each other. And honestly, in my experience, we've constructed a different answer every single time because every single situation is so nuanced and they are specific to each individual account holder as to how we answer. Because of that, we're going to have a whole event about it and we're going to really get into the nitty-gritty today. So a couple of things to note before we begin. Everybody has been muted as you join the call today. We are going to be asking you questions during the event today and to interact. So please listen for those cues. We're going to be using the chat function at the bottom right-hand side of the screen. So please go ahead, if you will, find the chat section, and then in the drop-down menu, click Chat with All Panelists. And we're also going to be utilizing the raise hand emoji today. So we're going to ask you to use this during the webinar if you would like to. You can use it any time, actually. Emojis are fun, but we'll give you some prompts. The session is being recorded, and you are going to receive a link in a follow-up email post-recording. We're also going to post it to our YouTube channel, which is youtube.com/watchpnfp. And finally, our presentation has been approved for continuing education credits for HR professional designations. So a certificate of completion will be emailed to you along with the activity code if you participate in the live event or attend the live event, rather. Okay. So one of our core values here at Pinnacle is learning, which is why we host these events. We're really passionate about our clients and our partners being empowered to make the best financial decisions available to them. We are a top 50 bank. We're headquartered in Nashville, Tennessee, and we're located across the Southeast as well as now Washington, D.C., and we're super excited about that. And here at Pinnacle, we offer a full range of banking, investment, trust, mortgage, and insurance products to employers and individuals who want a comprehensive relationship with their financial institution. And a final housekeeping note, because you can't have anything today without a disclaimer on it, especially for compliance folks like me, the information that we provide to you today could change tomorrow, especially with COVID-19 and the upheaval that it's caused in our space, in everybody's space, but especially employee benefits in the pre-tax world. And the regulators are all trying to come together and figure all this out. So there's lots of changes all the time and lots of clarifications on things that already exist. So this is what we know to be true as of today, which is February 16th, 2022. And also the information that we provide to you today is for educational purposes only. We're not providing specific legal, tax, medical, or financial advice. So please consult your legal counsel or your tax advisor or your medical advisor for your particular circumstance. Okay, so I want to go ahead and introduce ourselves and take this opportunity. First, I want to introduce you to Laura Lynn. She's an advisor on our health and benefits team, and you're going to hear from her today as she helps facilitate the chat box and the interactive sessions of the webinar. Laura, do you want to say hi? She might be muted. She says hi. Just wave. You're on camera.
Hi, everyone. Sorry, I was double muted. Good to see you all, and thanks for joining.
You can't be too careful. Double mute is like, it's like mega extra careful, so I get it. My name is Ferne, and I'm the compliance officer here on our team for the health and benefits team. And collectively, Laura and I have 29 years of experience in advising in the employee benefits space, so we're really excited to share with you all today. So thank you for coming. So before we get into the nitty-gritty, I want to give just a knowledge nugget on HSAs and retirement. The estimated amount of money needed to retire today and comfortably pay for your health care expenses is about $150,000 per person. That's a healthy person. Now, that $150,000 can be made up of 401k contributions, bonds, high-yield savings account, 401ks, IRAs. I might have said some of these twice now, but HSAs is really what we're going to focus on today because we believe, and many people believe in the financial space, that they are the premier way to save for your healthcare expenses. And the reason for this is because of the triple tax advantage, which no other benefit here on this chart offers you. That gives you a tax-free contribution, so the money that you put in, you do on a pre-tax basis or a tax-advantaged basis. Your earnings are tax-free, even the earnings that you get on your investments, if you choose to invest in mutual funds. And your distributions are tax-free, especially if they're for, specifically for healthcare expenses. And no other benefit here offers that triple tax advantage. And so that's why we focus on them today. Okay, so knowledge nugget done. The way that we're going to illustrate how HSAs work with Medicare is we're going to play the game of life, the HSA edition. So emoji show of hands, how many people have played the game of life, the board game before? Just trying to see who might be familiar. Laura, does it seem like there might be some peeps?
Oh, yeah, definitely.
Excellent.
Got a few responses out there that.
Oh, good. Even if you haven't played, we're going to talk about the rules. So the original game of life, you had to have the most money at the end of the game. And a fun story about me in the game of life, I'm super competitive. I've played this game. I've won this game. But as a kid, I think it might have driven me into this career path. At the beginning of the game, in the traditional game, you can buy insurance. And you take that risk if you don't buy insurance, right? Just like we all do throughout life. So I didn't want to spend the $10,000 on fire insurance until my life house burned down and I lost. And so ever since that time, when I played that game, I would make sure I bought insurance because I didn't want to lose. And one of my friends was like, that could be like generational trauma. I don't know, maybe. I don't think it was a trauma-induced decision, but I do think that your life choices determine your life outcomes. The pun there is absolutely 100% intended. So anyway, just a fun story, but enough about me because I can talk about me all day long. The object of this game, the HSA edition, is simple. You have to fully maximize your HSA account while you're eligible to contribute prior to retirement or prior to enrolling in Medicare. And you have to avoid all penalties. That's including HSA penalties and Medicare penalties. And I'm just going to tell you, it's a minefield. Not to scare you off, but these are just things that you need to be aware of. Now, each player is going to start out with a health savings account. It's an account, again, that you use for your healthcare expenses. So in order to play, you have to be eligible to contribute to an HSA. So number one, you have to be covered under a qualified high-deductible health plan. You can't have disqualifying health coverage or any other disqualifying health coverage. And you can't be claimed as a dependent on anyone else's tax return. Okay. Now, as I mentioned on the previous slide, in order to contribute, you have to be covered under a qualified high-deductible health plan. It's not just any health plan. This means that you have to meet certain thresholds in your out-of-pocket expenses before your health plan or your health insurance plan will pay. These are called deductibles. So most everybody knows what that is, I assume. That's your out-of-pocket expenses up to a certain limit. So self-only coverage for 2022 is $1,400. For family coverage, that is $2,800. And in addition to these deductibles, you also can't spend more than a certain amount or on your maximum out-of-pocket. So this maximum out-of-pocket also is shortened in this benefit space to MOOP. So you might hear MOOP, and now you know what that is. For self-only coverage, the MOOP is $7,050, and for family coverage, it's $14,100. We do get asked a lot, like, what goes into the MOOP? Base level, it's your out-of-pocket expenses. It includes your deductibles, your co-payments, your co-insurance. It doesn't include your premiums, so those are excluded. Okay. Now, HSA additions have limits. HSAs have limits. Otherwise, I would be rolling all my money in there because they're amazing. I mentioned 2021 here, even though we are in 2022, because you can still contribute to 2021 until tax day. And so if you were eligible in 2021, you haven't fully maximized that, you certainly can still do so by your tax filing deadline of April 15th. Now for 2022, those limits did increase slightly with inflation, so that's an additional $50 for self-only coverage, which takes you to $3,650, and your family limit is $7,300. And if you're over the age of 55, you can contribute an additional $1,000 to your HSA, and that's the same for either year. That catch-up contribution didn't change for inflation. Okay. Rules are outlined. We did a little knowledge nugget, some FAQs, just in general, like definition knowledge. We're gonna get ready to play the game. So showing off our game pieces, we have our Pinnacle HSA card, we have cash. We have our life card, which if you're familiar with this game, you draw a card and it gives you prompts and tells you where to go. That includes the HSA card, the benefits card, and a career card. We also have our spinner. And in any of these games, like Monopoly or like the Game of Life, you have someone who doles out cash, and this is the game banker. Except here at Pinnacle, we don't use that word banker. We feel like banker is a little transactional for us. We prefer advisor. And an advisor is someone who is not just going to be transactional with you. We try to empower you to make the best financial decisions available to you, and it's a true relationship. So that's why we use that word. And in this game, just like any true advisor, if you're making bad life decisions, like we're going to override you. So Laura and I kind of have a trump card to tell you no, but we probably won't have to use it. You guys are all great. Okay. So, folks, we have two teams here. We have a green team and a red team. If you're feeling bold, you can tell us in the chat which team you want to be on. You don't have to do that. And truth be told, this is going to be the most uncompetitive game of life you've probably ever played, because we want it to be fun. And you know what? If you change your mind in the middle of the game, that's fine too. Maybe the red team's life choices align better with your own journey. And listen, easy breezy. We're here to have a good time. So, as I mentioned, both players have a health savings account with a significant balance. They both meet the eligibility requirements to play, so you're going to have equal footing regardless. Now, like most board games, the youngest player goes first. I don't know who started that, but we're just going to keep true with that. The green player is 64, and the red team is 65. So the green team, you're going to go first, and just want to add, finishing first does not make you the winner. The goal here, again, is to fully maximize your HSA and avoid penalties. Okay, we're going to spin the spinner. Okay, 10 spaces. So green team, we're going to move your car 10 spaces. So fun. All right, green team, folks, in the chat, tell us which card you want. And Laura, just get like an average number of votes and let me know which card they pick.
Okay. Got a few responses coming in. Looks like, let's go with the career card.
Career card. Okay. Julie said HSA. We're gonna go with career card, Julie. We might get you on the next one. All right. Career card. It's 64. Okay, we'll see where it goes. I mean, lots of people don't, like, what are you going to do at 64? Are you going to retire? Are you going to keep working? I know a lot of people actually retire and start, like, brand new, like, hobby careers, which I think is excellent. So let's see what this is about. Okay, so you're going to continue working past 65. This is totally fine, and actually it's not abnormal. The baby boomer generation, the average age is about 67-ish for retirement, so really you're right in line to want to continue to do that. But what you're going to have to think about is Medicare eligibility and how this is going to impact your health savings account as well as your group health plan coverage. So your trusted advisor is going to help. Okay, so because our client is going to be able to enroll in Medicare prospectively within the next year, where coverage is going to be there on your 65th birthday, You have to decide, are you going to keep your employer-sponsored coverage? Are you going to do Medicare-only coverage? Or are you going to do dual coverage? And I want to say that if you work for an employer or you are an employer who has less than 20 employees, you may not get all these choices. It's pretty much Medicare only for you. Or, you know, in most instances, Medicare is going to be primary, but you're going straight to Medicare, and what that does to you is that changes your HSA eligibility. Regardless of any of these choices, Green Team, if you choose to do any Medicare coverage, dual or direct, you're going to lose your HSA eligibility because Medicare is disqualifying health coverage. Okay. Well, so let's think about this. You have a 7-month initial enrollment period to enroll in Medicare. Now, that's the first 3 months before you turn 65, the month that you're 65, and then the 3 months after you turn 65 that you can make these enrollment decisions in the initial enrollment period and be covered on your 65th birthday. You also have to think about late penalties. Because if you don't enroll in this initial enrollment period, there are late penalties associated with late Medicare enrollment. Now, you can avoid these if you keep your health plan coverage with your employer, so employer health plan coverage. You're not likely going to incur any late penalties. Your prescription coverage has to be creditable as well with your employer, and what that means is that it pays at least as good as Medicare would. And your employer is supposed to give you a Medicare Part D notice every single year that tells you whether or not your coverage is creditable or not. And it's due by October the 15th every year, which aligns with the enrollment period for Medicare, the ongoing Medicare enrollment period as you make decisions. So again, if all this matches, you know, you're in your employer health plan coverage, our coverage is creditable, maybe you want to consult a fact sheet. I found this amazing fact sheet on cms.gov about HSAs and group health plan coverage and avoiding penalties. I do suggest looking for it. It's amazing. Yeah, you can avoid penalties. You just really have to watch this because it can be a minefield. You should be talking with a Medicare advisor way before the age of 64 and financial advisors, probably around the age of 62. Or maybe even beforehand. You can plan this out way in advance, just don't wait till the last minute. Okay, so full consideration. He's going to keep his employer-sponsored health coverage. He's going to continue contributing to his HSA. He has a family HSA, so it's him and his spouse. So that's $7,300 that he can contribute, plus another $1,000 catch-up contribution because he's over the age of 55. So that's $8,300 going into your HSA account, and that, my friends, is maximizing your HSA eligibility. Okay, so red team, we're going to spin the wheel. Okay, so 10 spaces. Lucky number 10. All right, red team, chat, tell me which card. And then Laura, get an average and let me know.
All right, red team, let's see. Got a couple coming in. Oh, looks like HSA card wins.
Yeah, I see lots of HSAs. Yay, I love it. That's what we're here for, right? Okay. All righty, so red team, you're going to contribute a full $4,650 to your HSA for 2022. This means you have single high deductible health plan coverage, so your HSA limit is $3,650, and it's a $1,000 catch-up contribution. Your money's happy, it's doing a dance. All right, so you can make a full year's HSA contribution at the beginning of the calendar year, or the tax year that you're in, or you can wait till next year's deadline. But keep in mind that HSA eligibility is determined at the beginning of the month in which you're eligible. So if you've got like a forward-thinking outlook, like you're obviously thinking that you're going to be covered on a high deductible health plan, you can go ahead and put the money in there, that's fine. But just know that you don't really fully know if you're eligible until that month starts. So you have to be eligible the full 12 months during that same tax year that you want to contribute, or you have to meet something called the last month rule. And what that is on December 1st of that same tax year, you have to be HSA eligible. Not only that, you have to stay HSA eligible until 12/31 of the next tax year. So that's 13 full months of eligibility. But what that's going to let you do is fully maximize 2 full tax years of HSA contributions. Lots of people take advantage of this. It's a really great, it's a little convoluted as a thought process, but it's a really great way to maximize your eligibility for HSAs. All right, so money is going in the bank. Another way that you can maximize your HSA savings is by utilizing another kind of benefit account. It's called a limited purpose FSA, often shortened to LPFSA, which you see here. HSAs aren't compatible with any disqualifying health coverage. So if you have a medical FSA, or it's also called a general purpose FSA, or if your spouse has a general purpose FSA, that makes you HSA ineligible. But the really great thing about LPFSAs, or they are just for dental expenses only, okay? So these are called, they're accepted benefits. They're not going to impact your HSA eligibility as long as it's for dental and vision. So load up that LPFSA. They don't disqualify your HSA eligibility. Again, that dental and the vision, those expenses are going to stay in your HSA, and you're going to maximize your investments if you're keeping them in investments, and you can use that LPFSA to pay for them. But one thing to mention is LPFSAs are considered use it or lose it. You have a 12-month period in which you're eligible to contribute, and then it starts over again the next year. They are subject to employer plan designs, and honestly, they're not as accessible. Like, you can't walk off the street and be HSA eligible and go into a firm or just open your own individual LPFSA. An employer does have to sponsor that, and then you have to elect it. But you also don't know, like, are you going to have a rollover? Are you going to have extra time to use those funds? Those are also the employer plan design rules that you have to think about. It's a really great way to maximize. I fully maximize my HSA, and I fully max my LPFSA because I have a kid in orthodontic treatment. So that to me is worth it. So extra money in the bank. All right, so green team, it's your turn. Let's roll. All right, so we're going to move you 8 spaces. Okay, so green team, pick a card.
Several responses are coming in. Let's see. Let's go with benefits card.
Okay. I was curious. I'll allow it. Benefits card. Here we go. All right. Your spouse is going to enroll in Medicare. Now, this matters to you, green team, because you have a family plan and your spouse is covered on it. So this is going to impact your coverage. It's also going to impact your HSA contribution limit. Your spouse is happy. She's about to retire, and I'm happy for her. So a lot of planning is going to go into these types of benefit decisions, as well, again, personal research, reaching out to somebody early on to make these decisions. But you can also go to cms.gov, medicare.gov, AARP has some really great resources available. And we're also going to send out a one-page HSA eligibility checklist that ties in directly to Medicare as well at the end of the webinar, because you need a lot of resources. There's a lot of information out there, and we want to help you. You should be chatting with your HR department as well as your HSA advisor. So there's a whole team of people that want to help you retire correctly. Now, your HSA advisor notes that you're going to be switching to single coverage in the middle of the year. And that means that you're going to have to prorate your 2022 HSA contributions. So for the purpose of the webinar, we're going to assume 6 months of eligibility while we prorate, not because everyone is eligible for 6 months, but because it's just easy math. And that makes it easy for everyone to really compute. Because you have 12 months in the tax year, let's just have the tax year at 6 months. So the first step to determining your prorated amount in this little Proration 101 class is take your annual limit and divide it by 12. And since we're talking about family coverage, let's just go with 7,300 divided by 12. And that answer is 608.33. And step 2 is we're going to multiply the prorated amount by the number of months that you're eligible. So that's 6 months. And that answer is about 3650. And then you're going to prorate your catch-up contributions. Maybe. You don't always have to do this, but you should know how to do this. So prorating that is just you take that $1,000 divided by 12 times the number of months that you're eligible. And again, you don't always have to prorate, and we'll talk about that in a minute. And step 4 is you're going to add your prorated limit plus your prorated catch-up contribution to get your annual contribution, and the answer is $41.50. So we're going to move to the master class because this is not, everything in this space is nuanced. You're going to have to prorate your single coverage and your family coverage like halfway through the year for each plan. And then you're going to have to add those together to get your annual limit. And remember that I said that you don't always have to prorate that catch-up contribution. Here's a great example. You're not disqualified from contributing to an HSA. All you did was change your level of coverage. You're still qualified, so you are able to maximize that full $1,000 green team, so that's really good news. So we're going to prorate. So again, assuming 6 months of eligibility in family, and 6 months of eligibility in single coverage. Step 1, you're going to divide the annual family HSA maximum by 12, which was 608.33. And then you're going to divide the single HSA maximum by 12, which is 304.16. And then step 3, you're going to multiply the prorated amount by the number of eligible months in each plan. So your family answer is, that monthly coverage times 6 is 3650. Same for the single coverage, which is 1825. Adding that together, you're going to get your contribution limit, which is 5475. Plus, you didn't have to prorate your $1,000, so you get to add that full $1,000 in, giving you 6475. So you get to fully contribute to your catch-up contribution. So again, 6475. You're only prorating if you're disqualified. And one question that we get a lot is, I'm under the age of 64, my spouse is on Medicare, they're 65. Can I pay for their Medicare premiums with my HSA? You cannot. You can't if you're 65, that's just the rules. This is why a lot of spouses who are on family plans where they're not the subscriber to the medical insurance, they'll open their own HSA and they'll contribute their own $1,000 catch-up contribution to their own HSA. So if you're on a family plan and you are both qualified spouses, you could put a full $9,300 in as tax liability savings as a family. So that's really amazing. So yay, 6475 green team. And as I mentioned, the spouses get their own $1,000 catch-up contribution. And your spouse was contributing to her own HSA because she's savvy, she knows what to do, she wants to pay her own Medicare premium, she doesn't need any help. So prorated, she gets $500 for the year. Okay, red team, it is your turn again. And we're gonna move you 7 spaces. Okay, pick a card.
Let's see here. It looks like, let's go with another benefits card.
All right, Owen. Owen's the winner here. Benefits card. All right, red team, you're going to enroll in Medicare. We're going to navigate some minefields together. We're going to do it. All right. So you're going to have a special enrollment period for Medicare for Part A and Part B. Now, generally, this is going to be 8 months from when you lose your employer-sponsored coverage. You do have to navigate the late enrollment penalties. Again, they're there. And you do need to make sure that your RX coverage was creditable. So that notice that your employer was giving you, paying attention to it, they could ask for this. So it's just important that you keep it in your records. And again, CMS.gov, like this is my favorite fact sheet. You guys, if you want me to send you the link to it after the webinar, send us an email. I didn't link it here because we'll post this on YouTube, and you never know, the government's weird. But yeah, I'll send you a link to it. It's absolutely amazing. It's really, 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 really helpful. All right, so Red Team, since you're enrolling, I do want to do a quick rundown on Medicare, just kind of understanding what these parts do. Part A is your hospital coverage. It is generally free, and by free, I mean there's no premium. But you had to have worked, I think it's 40 quarters over your entire life, and paid Medicare taxes. So for folks who didn't work long enough, or for people who didn't work at all or pay taxes, you do have a premium, and your late enrollment penalties are 10% for twice the number of years that you did not sign up. Now, Part B is your doctor and physician coverage. There is a premium. And if you don't sign up when you're first eligible or within that special enrollment period timeline, your premium can go up 10% for each 12-month period that you should have had Part B, but you didn't enroll. And in most cases, this premium penalty does not go away, and it's cumulative. And for each year that you don't have coverage, it gets bigger. So this is a really nasty penalty, and we don't want it. Medicare Part C is also known as Medicare Advantage, and it's another way private companies sell a combo of Part A and B with some other things added in, but you still have to follow those eligibility timelines. It's just another way to get kind of a private-ish Medicare. And Medicare Part D is prescription drug coverage. So you have to enroll in Part D when you enroll in other Medicare Part coverage or face penalties. And Part D, the penalty is 1% per month, the national base beneficiary premium, which is a mouthful, but it's $33.37 for this year. And to get that penalty, you multiply 1% by the number of uncovered months, and then you round to the nearest 10 cents, and then you add that to your monthly premium. So following those special enrollment rules, making sure your insurance coverage or your RX coverage was creditable, following that initial enrollment period, like really communicating with the people in your life who are trying to help you get this coverage and, you know, not blow yourself up with penalties is really important. And because I like to complicate things further as a compliance person, if you enroll after the age of 65, you have a 6-month look-back period. That means that you have retroactive enrollment back 6 months, but not before the month that you turn 65. So again, contact your advisor, especially your HSA advisor. And the reason you have to do that is because you fully contributed for 2022, thinking that you were going to be eligible the entire year. Okay. This is not just 6 months like in Ferne's world where I'm trying to make this easy for you. This is truly 6 months retroactive coverage. So I want to clarify that. But we're prorating now. Now we have to, you still have to know how to prorate in order to do an excess distribution, because you have to figure out what that amount is, and you get that by prorating. So you have single coverage. You're going to take that single HSA maximum and then divide by 12, which we're going to just round up here at this point. It's 304. And you're going to multiply that by the number of eligible months. We are just going to assume it was 6 here. And then multiply prorated catch-up contribution by the number of eligible months. You are losing eligibility. You have to prorate your catch-up. And then you're going to add these together, and you're going to get your total annual contribution of $23.25. So what do? You have to take an excess distribution from your bank, which hurts, but you don't want that excess tax. You have to make this correction prior to tax day in the next year, and if you don't, no, this guy's like, no. Nobody wants to pay more taxes, especially penalties. The 6% excise tax is cumulative, so it impacts the year that you didn't take it out and following years, especially if you gain some kind of interest on it. So it's a real doozy of a penalty. And excess distributions are normal. Like, they're not going to hurt you come tax time. What hurts you is if you don't take it out. So we're good. You avoided a penalty. We're doing great. Let's see, green team, it is your turn. Oh, where did your, maybe there's a problem with the slide deck. Oh, okay. You're going to skip some turns because you're still working. All right. Well, hey, again, the point of the game is not to finish first. It's to avoid penalties. So you're going to keep working. Good for, listen, I love my job. I'm going to work as long as they'll let me. So good for you. All right. So let's go to the red team. Oh, wait a minute. Green team, your spouse is going to take a vacation. She's earned it. Let's see where she's going. Super happy. Fern, what do HSAs have to do with vacations? Absolutely nothing. But if you strategize properly, you can save for anything with your HSA, including a vacation to the tropics. We call this the Shoebox receipt method. So while you're still contributing to your HSA, rather than use your HSA funds at the time that the qualified expense is incurred, you pay with your normal bank account. So just your check card, you go in there, you pay that bill, and then you shoebox that receipt. You're probably not keeping your tax files in a shoebox. It's just a term, but you can take a picture of it. You can upload it in a mobile application. If your custodian has a mobile app, it'll help you save those receipts. And you can also keep it with your other tax forms. But there's no deadline to reimburse yourself for a qualified expense as long as you were contributing to an HSA at the time of an expense or eligible to contribute at the time and you were enrolled in an HSA. You could do this for many years and reimburse yourself thousands of dollars all at one point in time in your life and use that money to take a vacation. It's totally legal, it's totally legit because you've already paid the taxes on this money. You're just getting that money back and reimbursing yourself. So it's a really great way to save, like your spouse decided to do. In a true story, one of our associates' former coworkers paid for their son's college tuition using this method. And again, it's totally legit and it's totally a way to save for really anything you want. And to add, you can also do this and later in life at 65, not having used this method and paying for your expenses and just treating it, those deductions like normal income. I don't know that, you know, whatever floats your boat. There's lots of ways to save with your HSA. All right, red team. All right, you're gonna move to spaces. You're at the end of the board, yay, you're retiring. Good job. All right, so HSAs after Medicare. So what are you gonna do with all these tax-free savings and the interest that you earned in your HSAs over the years? You could take a vacation. I think that if you want to. But your qualified HSA expenses are tax-free. So you're not going to have to pay taxes on those distributions like you would if you're using your 401k. Your non-health expenses that you use your HSA for are taxed as normal income. And you can pay your Medicare premiums with your HSA. So you win, not just the red team, both teams win. Because if you guys remember, it's not about finishing first, it's about avoiding penalties, which every single one of you did. Our advisor is super proud of you. We're proud of you. So cheers to retirement and HSAs and continuing to work for the green team because work is fun. Okay, so if you, outside of the game of life, there are some Medicare eligibility nuances. You might become eligible for Medicare before you turn 65. You're not even close to retiring in some of these cases. The first one is you are diagnosed with end-stage renal disease, also shortened to ESRD. And this is when you have advanced stage kidney disease, you are likely on dialysis or you're on a transplant list or both. If you are on Social Security disability or you're receiving Social Security income in any way, shape, or form, you are automatically enrolled in Medicare. Part A. And now disability, you have to be disabled for a certain period of time. But anytime you're receiving those benefits, you are going to be on Medicare, and that's going to make you ineligible for an HSA. If you're diagnosed with Lou Gehrig's disease or ALS, you're going to be on Medicare. And to think about this, like all of these eligibility requirements are different for every single circumstance. So if you are diagnosed with ESRD or ALS, or you become disabled, or you start getting on Social Security income for whatever reason, or your spouse, like talk to your HR department, talk to your advisors. Everybody's here to help you navigate that situation and to be there for support. And another kind of real, in my opinion, nuance that I wouldn't have known about necessarily is if you are receiving railroad retiree benefits, so you worked for the railroad and you're getting those benefits, you get Medicare at 64.5. So you have to think about your HSA contributions if you were eligible in a different way. Okay, so there are other HSA strategies that aren't Medicare, have nothing to do with it. Now, perhaps you find yourself in a situation where you can't fully contribute to your HSA for the year, but you're still HSA eligible. Maybe you're cash-strapped. You have a big health expense, but you've cut back. So you have your employer health coverage, you've cut back your hours. This means that you have less money that you can put into your savings fund. Maybe you've been contributing to an IRA, a traditional IRA, or have one from the past. You can do a once-in-a-lifetime IRA rollover, and that's not once in a lifetime per the IRA. That's like once in your whole personal lifetime. The reason that you might want to do this, because I get this question a lot, one, HSAs have better tax advantages. Number two, the reason that I get this question a lot is because that rollover counts towards the contribution limit. So if you were to roll over $3,000 and you're got like single coverage, you only have about, I don't know what the limit was unless I look at it because that's just my life, but you don't have that much more for the year that you can contribute. It's only maybe, a little bit of money. I think it's $150 extra maybe. So you have to think about that limit as you're thinking about making these plans. But what makes this really nice is you didn't have the money to put in there anyway because you're cash strapped. So that transfers your balance from one account to another and allows you to take in those tax advantages and perhaps put that money towards whatever health expense that you were having, which all your money is going to that anyway, right? Because healthcare is expensive. And one thing that you have to know is you have to remain HSA eligible for the 12 full months after the rollover occurs. So this is just important to keep in mind. Okay, so we're done playing the game. I want to open up the questions for everyone to, hit me up, ask questions in the chat. You can email us at health@pnfp.com if you have questions and you're not able to stick around for the chat portion and the question portion, or if you want to get on our future webinar list, that's a great way to get on it. So please send me your questions. I did see some questions. Hey, yeah.
Yeah, I saw that we got a couple questions throughout the webinar on the scenario when two spouses are on a family plan together, and both are age 55. What is their total contribution limit? Can you kind of talk us through how that works and how they would have to set up their accounts and options there?
I sure can. Yeah. So the HSA is not a family HSA. It's really an individual's HSA. It's just their contribution limit is based on the health coverage that they have. So for example, the green team, the driver of the green car, they were the subscriber on the health plan and they have the family coverage under their account. So they open their own HSA and they decide they want to put $7,300 in it, okay? It means they get an extra $1,000 that they can put in their account. But it doesn't have to be that way. You could split that in half. where like your spouse puts their one. Now the spouse, they all have to have their own catch-up contributions and their own HSAs. There's no blendy of that. So it's catch-up here and catch-up here in their own accounts. But this $7,300, you could split that up however you want. You could put $3,000 in here and $4,000 over here in the other account. That's fine. The only true advantage, or the true advantage in my mind, is if you have an employer who is pre-taxing that money from your paycheck. You're saving on FICA and FUTA right there on the front end. And your employer's also saving money on FICA and FUTA by pre-taxing those HSA contributions. So most people want to go that pre-tax route and would rather the money come out pre-tax and go to the HSA. Otherwise, you're having to do it really post-tax and then taking the money as a top-of-the-line deduction from your tax returns. Works out the same, but yeah, so you can kind of split that limit up any way you want. It's just your catch-up contributions have to be in their own account.
Hey, Ferne, one thing I was thinking of that may be impactful to a couple in making that decision is based on a comment that you had made earlier that you can't pay your spouse's Medicare premiums until you turn age 65. Would you agree with that?
Yeah, I do agree with that, and that is one strategy where if you're thinking that your spouse is going to be eligible, like in this green team circumstance before you, you could split up those HSA contributions sooner, or specifically for, and not just that $1,000, but maybe you want that separated out half and half intentionally, so that they have enough money to pay for their Medicare premiums. That's right.
Awesome, fantastic. So another question that we got is, what types of coverage besides Medicare would disqualify contributions to an HSA?
Yeah, so that's a good question. That comes up a lot too, because people are, it's actually not funny. It disturbs me. It makes me sad when people lose HSA eligibility, but people are surprised to find out there's a lot of things that can disqualify you. The number one is the health FSA. You can't have both. Your spouse cannot have a health FSA while you have an HSA. That disqualifies your HSA eligibility. HRAs that pay prior to you meeting that HSA deductible will disqualify you. And if your spouse has like a medical HRA that pays prior to that deductible, that will also disqualify you. Let's see, if you have VA benefits, that could disqualify you unless it's for a service-related disability or you go in for preventive services only. You're not disqualified the full year if it's a disability-related illness. You're just disqualified for 3 months after the visit. Indian healthcare, so Native American healthcare, tribal healthcare, disqualifies you because it's disqualifying coverage. Medicaid, TRICARE. Let's see. There's some nuances here too, which people don't know about. So if you're an employer who has an on-site clinic, if that gives you like lots of benefits, and that's not the word, but like essential benefits, that on-site clinic could disqualify you. Let's see. That might be it. I'm sure I've forgotten some. I just want you to know that there's a lot of them. Oh, telehealth can disqualify you. During COVID, I don't know if anyone saw this, but it was not disqualified during COVID to see the telehealth doctors without having to pay. Essentially, the reason for that was because no one could go to the doctor, right? Well, that went away 12/31, which was a downer. Everyone really wants that to come back, but that's a gray area too. If you aren't receiving, that's the word, significant benefits, like if you're just seeing a teledoc for preventive, there are some people that argue that maybe you can have like some kind of cost sharing in some way. And so anyway, there's a lot of arguments in that space, but that just kind of illustrates the nuances that come with it. Good question. I didn't touch on it in the game.
I have another question here. What insurance premiums can be paid with those HSA funds?
Good question.
What types of insurance?
So obviously, Medicare, if you're 65, you can pay for COBRA premiums with your HSA. You can pay for medical, dental, vision premiums with your HSA as long as they haven't been pre-taxed. So you're probably paying for them yourself. You can pay for long-term care insurance premiums. Things that you can't pay with your HSA, because I get this question a lot, life insurance. You can't pay for your life insurance. You can't pay for accidental death and dismemberment. You can't pay for like pet insurance, trust me, I've been asked this, or automobile insurance. You can't pay for accident, cancer, hospital indemnity insurance, specified disease coverage, any of those like voluntary benefits that are going to give you a certain amount for a certain number of days, or if you're diagnosed with a certain type of cancer, you know, hopefully not, that is not payable as with your HSA as a qualified premium. And I do recommend going to IRS Publication 502. That's kind of the breakdown of the list of everything that is a qualified medical expense. It doesn't get super nitty gritty, but using it to file your taxes if you, if you itemize, or if you're trying to pay for something with an HSA, knowing that you're doing it the right way.
Okay, I got another one for you. In your broker newsletter, you had mentioned a law change in Oklahoma that impacts HSA eligibility. Could you elaborate on that a little bit more?
Yes. So this is a real bummer too, because again, I get sad when people lose HSA eligibility, especially when I see myself in this circumstance. The new Oklahoma law passed at the end of 2021, or became effective, I should say, in that if you have a qualified high deductible health plan and you have not met your HSA deductible, which remember I said was $1,400 for single coverage and $2,800 for family coverage. If you haven't met that deductible and you use a prescription drug manufacturer's coupon or some kind of rebate or some kind of incentive, your insurer is required to make that notation. They apply that towards your deductible, but then they don't consider that like your out-of-pocket expense. They consider that first dollar coverage, which you can't have with an HSA. You can't have anything that pays before you do, including a health plan or including a coupon in the eyes of Oklahoma, which we all know prescription drugs are super expensive. So, I mean, I just used GoodRx last week to save a ton of money on a prescription. And so the IRS kind of agrees with this view, but doesn't really care about it. They don't enforce it. I'm in North Carolina, my insurance policy is through Tennessee. It doesn't impact me. That's why I'm so flagrantly talking about the fact I could use a coupon. But there are also some nuances here too. In Oklahoma, it's only for fully insured Oklahoma policies. So, and the reason for this is self-insured plans aren't subject to state insurance laws. They're preempted by ERISA. So if you're an employer, or if you, we may have Oklahoma peeps on the phone. If you, that would be wonderful. If you have, if you're a broker and you have a self-funded health plan out of Oklahoma and it's through Oklahoma Blue Cross, I'm not sure what carriers are out there. Then your self-funded health plan is fine, but your fully insured health plan, qualified high deductible health plan, these things can disqualify the plan for that person. So yeah, I don't love that. It's official. The IRS didn't debunk it, so I think it's going to stick around for a while. Good questions, guys.
I think we've answered most of the questions, and I think you touched on this a moment ago, but I did receive a question about long-term care premiums. Can those be paid for with an HSA?
They can, and there are some nuances to it, which whoever asked that question, I'm happy to kind of dig in a little deeper in terms of what those nuances are exactly. But long-term care premiums, totally fine. You can pay with your HSA.
Another question here, are owners allowed to participate in an HSA?
Not pre-tax. Well, and I guess I should clarify, owners depends on what kind of owner you are. So if you are in an LLC and you're taxed as a partnership, no, partners can't participate. If you are greater than 2% owner in an S corporation, no, you can't participate. And when I say participate, I mean pre-tax. You can't run this through your payroll and take it out of your paycheck. You can participate and do an above-the-line deduction, and that's going to work out well for you. It's just a little bit different. Now, if you're any other kind of entity and you're an owner, you can run it through your payroll pre-tax. So no one's really like not allowed to participate necessarily, just being an owner. It's just you have to do it in a different way depending on the type of entity you are.
Okay, well, I know that there may still be a few questions out there that we haven't answered that are a little bit more Medicare specific, and that we may want to do some additional research or ask you some additional questions on before we answer. So for those folks that didn't get their questions answered, we will be following up with you via email to help with those. But otherwise, I think we've concluded all of our questions. Ferne, if you have any other comments, I'll let you wrap us up.
Yeah, well, thank you everyone for coming. I loved the questions. I'm excited to see what other questions came in because I love some good stumpers. So anyway, we're here to help. So anyway, shoot us an email at health@pnfp if you want to get on our webinar list, or if you have questions you feel like we didn't answer, or you just want clarifying questions to that, we're here to help. So thanks everyone for coming.